From the spread of monkeypox across the U.S. amid the ongoing COVID-19 pandemic, to restrictions in access to health care for people who can get pregnant, and the rise in youth suicide, we want to make sure that you have the information that you need to stay safe and are aware of some of the major health topics in the country right now. Welcome to Verify This, the show that answers your questions and separates fact from fiction so that you can determine whether viral claims online are true or false. I'm your host, Adiante Till. Here's a look at the 5 health-related claims that we're covering today on Verify This. Is monkeypox a pandemic? What about a sexually transmitted disease? Can pharmacists refuse to fill a prescription issued by a doctor? Methotrexate can end a pregnancy, but is it also used to treat certain diseases? And in a Verify special report, we looked into the rise in youth suicides. Today, experts address how to talk to kids about this serious topic. The answers to these questions and more coming up on Verify This. Public health officials continue to track the spread of monkeypox, as the case count has now reached the thousands, and the WHO has designated the virus a global health emergency. Brandon Lewis looks into whether monkeypox is now considered a pandemic.
The Centers for Disease Control and Prevention confirmed there are more than 16,000 monkeypox cases worldwide, including more than 2,800 in the U.S. Some social media users are wondering if this means monkeypox is a pandemic. And one epidemiologist argues in a tweet with 6,300 likes that it certainly should be. So let's verify. Has monkeypox been declared a pandemic? Our sources are the World Health Organization, the CDC, the White House, Columbia University's Mailman School of Public Health, and Catherine Jacobson, an infectious disease epidemiologist with the University of Richmond. Only the WHO can declare a disease a pandemic. Currently, it refers to monkeypox as a global public health emergency, not a pandemic. Both the CDC and White House refer to monkeypox as an outbreak. Jacobson says this is because cases are primarily in cities among men who have sex with other men. But the U.S. is starting to see more cases in women and rural areas.
At that point, this would certainly be considered a widespread epidemic.
So, no, monkeypox has not been declared a pandemic. Even if that were to happen, Jacobson says she does not expect it will be anything like the COVID-19 pandemic because monkeypox doesn't spread as easily. With your Verify, I'm Brandon Lewis.
We've received a lot of questions about how monkeypox spreads. The most common claim we've been asked to look into is if monkeypox is a sexually transmitted disease. Brandon Lewis answers this viral question and gives some important context.
Cases of monkeypox continue rising nationwide. The Centers for Disease Control and Prevention says monkeypox is currently most prevalent in urban areas among men who have sex with men. One tweet with more than 4,000 likes asks if monkeypox is a sexually transmitted disease, and data from Google Trends shows an increase in people searching for that answer. So let's verify. Is monkeypox a sexually transmitted disease? Our sources are the CDC, the World Health Organization, the National Institutes of Health, and Dr. Robert Murphy with Northwestern University. The WHO defines an STD as a disease that's transmitted predominantly through sexual contact, like herpes or HIV. There are other ways to get a disease that's considered an STD, but sex is the main way because of the exchange of bodily fluids. Monkeypox is spread through person-to-person contact, but Murphy says that doesn't have to mean sex. The CDC explains the virus can enter through broken skin anywhere on your body, the respiratory tract, mucous membranes in your eyes, nose, and mouth, or even touching clothing that came into contact with an infected person's rash. So even though monkeypox has predominantly spread among men who have sex with other men, the virus can spread among anyone who has close contact with an infected person, whether they have sex or not. So, no, monkeypox is not considered a sexually transmitted disease. With your Verify, I'm Brandon Lewis.
Are you following us on TikTok yet? Well, you should be. We verify all sorts of questions on the app, like this one about whether President Biden stopped a Trump plan to make insulin cheaper. To watch the full video from Verify's Casey Decker, search for Verify This on the app. And you can binge even more of our healthcare stories by going to the healthcare playlist in our bio. It's time for this week's first Did You Know, where we feature one relatively unknown interesting fact that we, of course, verified. Did you know that 25% of Americans use 3 or more prescription drugs a month? It's true, according to the CDC. That number jumps to 50% if you consider Americans that take at least 1 prescription drug a month. In this next story, Casey Decker looks into a claim that pharmacists can refuse to fill a prescription issued by a doctor.
The consequences of the Supreme Court overturning Roe v. Wade and allowing states to ban abortion are broad and sometimes unexpected. For instance, several people have said their pharmacist refused to fill their prescription because the prescribed drug could in theory be used for a medication abortion. But is that even legal? Can pharmacists refuse to fill a prescription issued by a doctor? Let's verify. Our sources: Anna Legra-Dopp, the Senior Director of Clinical Guidelines for the American Society of Health System Pharmacists; Donald Miller, a professor of pharmacy practice at North Dakota State University; and various state laws governing pharmacy practice. The simple answer is yes, pharmacists have discretion to fill or not fill prescriptions. There are any number of reasons why they might choose not to. It might be a suspicious prescription for opioids. It might be because the new prescription could interact negatively with other drugs the patient is taking, or the pharmacist might suspect an error in the prescription.
Pharmacists are not machines. They always use judgment in dispensing.
In fact, state laws often explicitly state that pharmacists have a duty to use that professional judgment. In some states, they can refuse to fill a prescription purely because they have a personal objection to the drug. Many states and pharmacies require that in those situations, the pharmacist refers the patient to another provider or hands them off to a colleague, but not all. So we can verify, yes, pharmacists can refuse to fill a prescription issued by a doctor. Now, what we're seeing right now isn't necessarily a personal objection on the part of pharmacists. It's a fear of possible legal consequences for providing the drug. For instance, methotrexate is commonly used to treat a number of conditions, like rheumatoid arthritis, but in higher doses is sometimes used to treat ectopic pregnancy. That means in some states it is classified as an abortion medication, potentially exposing pharmacists who provide it to legal repercussions.
We don't know what the ramification will be experienced now as a clinician tries to make these decisions, or if they might be prosecuted 10 years from now.
So how can you avoid hitting these roadblocks if you need a drug considered to be an abortion medication? Experts say the best ways are to have your doctor write the reason for the prescription on their note to the pharmacy, and to build a relationship with your pharmacist so they already know who you are and what you're using the drug for.
As long as there is a reasonable expectation that the prescription is legitimate, you should be fine.
With your Verify, I'm Casey Decker.
Our Instagram page is a one-stop shop for all of our fact-checking content. With just a quick scroll, you can see some of our verified headlines, like this one, confirming that Walgreens employees can refuse to sell condoms because of their religion. You can click on our Reels page to have one of our reporters walk you through a fact check and watch clips from our experts. To check out our page, search for Verify This on the app. Next up, medical organizations are reporting that some patients can't access methotrexate, a drug that can end a pregnancy, in some states with abortion bans. Our team looked into claims that methotrexate can also be used to treat other health conditions. Here's what we found. Many states have implemented bans or restrictions on abortion, including medication abortions, following the Supreme Court's decision to overturn Roe v. Wade. Since the laws went into effect, some people say that methotrexate, one of the drugs that can be used in medication abortions, is not available for other treatments, like rheumatoid arthritis and cancer. Many have shared stories of pharmacies refusing to fill prescriptions for the drug. So let's verify. Is methotrexate, which can end a pregnancy, also used to treat certain diseases? Our sources are the Food and Drug Administration, the American College of Obstetricians and Gynecologists, the American College of Rheumatology, the Arthritis Foundation, and methotrexate user Daisy Fontanez. Methotrexate is approved by the FDA to treat inflammatory conditions and some autoimmune diseases, including psoriasis and rheumatoid arthritis, as well as some forms of cancer. It isn't approved by the FDA as a medical abortifacient, but doctors use it as an off-label treatment for ectopic pregnancies, a rare, potentially life-threatening condition that occurs when a fertilized egg implants and grows outside of the uterus, according to the American College of Obstetricians and Gynecologists. Methotrexate works to treat autoimmune diseases like rheumatoid arthritis by decreasing the immune system's activity, and treats cancer by slowing the growth of cancer cells. The American College of Rheumatology says methotrexate is one of the most effective and commonly used medications in rheumatoid arthritis treatment. Verify viewer Daisy uses the drug to treat her RA.
I've been using it for 12 years, and the minute they try to start to reduce it, there's a part of me that's going to start screaming. Part of my body that will start screaming.
So we can verify, yes, methotrexate, which can end a pregnancy, is also used to treat certain diseases such as rheumatoid arthritis and cancer. If you see something that you want verified, just send us a text at 202-410-8808. Once you sign up for our daily fast facts delivered straight to your phone, you can start submitting those claims. And if you want to be really fancy, record a video of yourself asking that question and then email it to questions@verifythis.com. You never know. Your question could be answered in next week's show. Next up, we have time for one last Did You Know? Did you know that the Suicide Prevention Lifeline has a new number? It's 988. As of mid-July, you can now call or text the number 988 to be connected with a trained mental health professional. If you're thinking of suicide, if you're in any other mental health crisis, or if you're worried about a friend or loved one and would like some emotional support. In a Verify in Focus report, our team looked into how a decline in access to mental health services has coincided with the rise in youth suicide over the past decade. In this excerpt of our report, experts address how and when adults should start speaking to kids about suicide. The age is younger than you may think.
We didn't know where this came from. He was a normal kid, loved life, went through his text messages, his cell phone. There was no indicators in there at all. He was a leader, as far as we could tell.
Had no clue. Absolutely no clue. I knew he struggled sometimes, but I've seen him on the phone with his friends. Him and I would talk, but he would never bring that up to me.
Dr. Nancy Turner, Director of Mental Health for the Rock Hill School District in South Carolina, says there's no set age for when a child starts to understand what suicide means. But throughout her 20-plus years working with children, she says they're getting younger and younger. A 2020 study published in the Journal of the American Academy of Child and Adolescent Psychiatry found that children with depression between the ages of 3 to 6 years old had an idea of what suicide is and had an advanced understanding of death compared to their non-depressed peers. A 2021 report from the U.S. Surgeon General highlighted the increase of high school students' mental health symptoms over a 10-year span, from 2009 to 2019. Students with persistent feelings of sadness or hopelessness increased by 40%. Students considering attempting suicide increased by 36%, and students creating a suicide plan increased by 44%. Recognizing suicidal ideation in loved ones can be challenging, but Dr. Turner says there are actions parents can take.
First and foremost, listen to your child, ask direct questions. As early as 9 or 10, it seems so young. However, if we're hearing signs and seeing signs of depression or seeing signs of students feeling alone, or they may feel rejected, parents notice this. They might think, well, they're going through something. Don't wait. Be direct. Ask questions.
Dr. Turner notes that there are small warning signs parents might miss: a change in eating or sleeping patterns, if they start giving away their personal belongings, if they lose interest in their favorite pastime, they drop out of an after-school activity, or suddenly withdraw. And Dr. Turner's advice to parents?
Ask that direct question. Are you thinking of hurting yourself? Are you thinking of killing yourself?
Tara Lowry and Brad Hunstable hope the conversation about youth suicide won't stop with their stories.
My big thing is it's got to get out into the schools and out into the public. Everybody thinks it's the elephant in the room and nobody wants to talk about it. And it's right in our faces.
Talking about mental health in school has traditionally been taboo. And I get it. It's a scary topic. I mean, suicide and depression, anxiety are very scary topics. And when we don't know what we don't know, we tend to pull back. And unfortunately, that's the wrong thing to do.
I am one of those. I am done with this. I'm done with people hiding it. It's got to get out there. It's got to get out there.
If you or someone you know is in a crisis or having thoughts of suicide, call the Suicide and Crisis Lifeline at 988. The Lifeline can also be reached at its former number, 1-800-273-8255, or online at 988lifeline.org. On behalf of our entire Verify team, thank you so much for sending us your questions. We really hope that you learned something new from the show today. I'm your host, Adiante Till. If you're craving even more fact checks, head on over to the Verify This YouTube page. That's where you can find bingeable fast facts, extended interviews with our experts, and lots of fact checks. And while you're there, don't forget to hit that subscribe button. And as always, if there's anything else that you want us to verify, just send us a text at 202-410-8808. And if you send us your question as a video, you could end up in the show. Our number is still on the screen, so make sure you lock us in, and we'll see you back here next week with answers to more of your questions verified.